Welcome to the Health Science Coach Podcast. My name is Drew Garner. I am a health science and physical education teacher here at Turner High School. My objective is to provide information to students about different healthcare careers and explain how these professionals got to where they are in their careers. Thanks for spending some time with us today. Now let's dig in. Today we have the pleasure of meeting with Sarah Stelmach-Brown. She is a certified nurse's aide and certified medical aide. She also has the host of the Caregiver Chronicles podcast. Welcome, Sarah. How are you?
I'm great. Thank you so much for having me. I really appreciate being here.
Absolutely. We look forward to, hearing your story and why you kind of got into being a CNA. We were talking before I hit record about you starting as a high schooler, as getting your CNA as a junior. Let's share a little bit about how you started so early and what that allowed you to do.
Yes. So I'm going to be very honest. I was not the best high school student. I was kind of like a CD student. I really was never, I didn't really like school that much. I just was not the best student. However, if there was a person with special needs or a person who needed help, they would catch me in the background, even though I had a little smart mouth and an attitude and didn't want to do my schoolwork. If the blind girl needed help getting to class, I would help her. Right. If I saw someone picking on a kid with special needs, I would stand up to the bully and be like, listen, no, we're not going to do this. And I would walk the kid to class. And a few teachers and guidance counselors saw these things and kind of recognized that there was something a little more than my attitude back then to me and my lack of caring about education, and sat down with the guidance counselor with the discussion of what do you want to do with your life? What do you want to be when you grow up? And truthfully, I was like 17. I had no idea. I took, the test to see where I would fall, what I'd be good at. And nursing was one of the things that came up. Nurses, doctors. Well, I knew I was never going to be a doctor. There's no way I could do 8 years of college, nor did I have the interest. Honestly, even as a nurse, I never really wanted to do that much schooling. In truth be told, after being a CNA and spending time with registered nurses, I really knew I didn't want to be a nurse. However, I loved being a CNA. I was fortunate enough in my town, there was a nursing home that was doing some training. The training was paid, so I got paid to do the training in addition to getting high school credit for the class to kind of cover the classes that I was not doing well in. I took the training. I passed the training. I started working in a different facility. They had a lot of staff at that facility. They couldn't keep everybody, all the new hires that they hired. They could not keep them all. So I started working in a different facility. That facility was willing to work with the school with a work program where I was also able to continue getting credits for the end of my junior year in high school and 2 semesters of my senior year of high school where I'd get work credit, which was really great for me. Yeah. So that's kind of how I got started.
Okay, cool. So when you started with that, what were some of the tasks once you were a CNA that you would do on a daily basis? Like what is the role of the CNA and what do you help with?
Well, I'm going to get a little bit raw here because, I don't want to candy coat things for anybody who's really interested in this. Care, toileting. That's the first thing I did when I went in on second shift. I would bring people to the bathroom, change them, clean them. And a lot of people say that's all CNAs do, but it's not. Very quickly, I learned to get to know older people. I learned how to try to relate to them. I was just a young girl. I was 17. I'm taking care of people who are 90. Some of them are looking at me like, okay, she's cute. She thinks she's going to get me washed up. Oh, no, she's not. Right. And others are looking at me like, oh, look at this cute little girl trying to help. And in my approach had to change room to room. And I had to learn to almost act. I don't know almost acted differently for each person. And the other thing I really had to learn was talking to families, talking to residents, and going into their world. I had always just been absorbed in my own world. I never had to really think about outside my own box, my own, what I had to do in the day. I never had to care about other people. I'd never had experience with that before. I had to go into their world. If someone was upset, I had to learn how to calm them down, whether it be talking about their family or playing their favorite music, whatever it was. I had to learn compassion and empathy really, really fast.
Yeah.
I don't know that you can learn it, but
Right. Getting involved with that, you being able to have to just communicate and being able to be in their shoes for a minute and really step in and see what that looks like. Absolutely. So after a few years of being a CNA, you went ahead and got your medical assistant certification. What are some of the
medication aid?
Medication aid. Sorry, medication aid.
Yes.
And what were you able to do with that was different than just being the CNA?
So I was working at my facility. I had actually left CNA work for a little while and did bookkeeping briefly. Hated it and knew then, okay, I want to go back into CNA work. I want to work directly with patients. I just feel like that's really important to share. That I did take time to do other things, but really when I went back, I really kept going back to that CNA role. I wanted to do medication aid because I wanted to do more than just CNA work, but I still really didn't want to become a nurse. I saw the nurses in the facility and they were doing so much paperwork and they had so little contact with the residents. I saw the nurses in home care and they were behind the desk. They hardly saw the clients, maybe once a month, if anything. Nurses in hospitals, there's great paths if it's for you, but it wasn't for me. And I recognized that. And I was very fortunate to already have what I loved. The medication aspect, I was always interested in. I was always interested in medications, how they work in your body. And so taking that next step kind of came natural to me because I would still have patient contact. So that was I took my class at New England Gerontology Academy. It was a 16-week, I believe it was 16 weeks. It might have been 18-week training course. And I had to memorize 125 different medications, their side effects, their drug class.
Yeah.
And again, mind you, I was a horrible student. I had to memorize, 125 different medications, their brand name, generic name, drug class, side effects, and what they're prescribed for. I went on to I have probably more medications than that in my head. If you ask me a question about a medication, I can probably answer it through experience.
Right.
But it was a really great training for me. I was a med tech for, I don't even know, 14 years. Since 2008, I've been a medication aid. And it basically gave me an extra license to pass medications.
Okay, absolutely. And then so recently you had talked about, being able to prepare for life. Before I hit record, you had said that you were able to take care of your grandma when she was passing. Let's talk about how your CNA and medication aid training allowed you to, be able to handle that situation so professionally.
So another not fun part of the CNA job, this is the part of the job that I don't love. But I have a lot of respect for it, and it's very tender. Sometimes people die.
Yeah.
A lot of times people die. It's very rare if you work in a long-term care facility that somebody goes on to go back home. Usually they either pass away there or they pass away in the hospital. I did have hospice certification training when I did home care briefly. They did have that. So I did have like a little hospice certification that if I wanted to do hospice care, I could. I haven't really thought about doing that much until more recently. But being around people in that tender transition and being there for it, the only thing that can prepare you for it is experience. It's I don't want to get too like spiritual or anything, but you know, when someone passes away, they're coming from what their present body is in to they're gone. You know, their body is no longer working, and it's a process. It's a clinical process, and for some people, it's a spiritual and emotional process. And I've seen it so many times. And you know, I can't think of a time I didn't cry when I was there when someone passed. And I know they say you're supposed to suck it up and you're not supposed to feel anything. You're not a robot. You're a human being. You're allowed to feel. You're allowed to cry. It's better to take a minute, go to the bathroom and cry, take a deep breath and get back to it than it is to hold that in. It's better for your mental and physical health to be human. We've had, you know, unexpected passings working in the field. I've had to do postmortem care, which I was fortunate enough when my grandmother passed. The CNAs weren't really letting anybody do postmortem care at the time, or the facility wasn't really letting anybody, but because they knew I was a prominent caretaker for my grandmother, my mom was kind of the primary person, and then I was the secondary person, and they knew that. And they also knew that I was a CNA, and they were like, I was actually there in uniform. I had left work to go be there with her during that moment. When I got the call that, you know, her body was actively shutting down, I made sure that I got there. And, you know, doing that postmortem care, it's just so tender and precious that the only thing that can prepare you for it is doing it. If it's your first time having to do postmortem care, I really recommend to never send somebody in the room alone to do that. I would never send a new CNA to do that. That would be, you need just someone experienced.
Yeah.
So.
Awesome. And then we talked about a little bit about, you know, just having a CNA certification to help prepare for life. Other than that, you talked with me about your sons and being on the autism spectrum. How has your CNA world professionally helped you, you know, with your home life and being able to navigate the two?
It's overlapped significantly. I cared for my grandfather before he passed as well. My youngest son has very prominent needs. He's on the autism spectrum, and he has very prominent. I apologize if there's background noise.
Nope, that's totally fine. We get it.
There's construction back there, and I do apologize for that. Okay. He has very prominent physical needs. He's 6 years old. He cannot speak. He's still in diapers, and he has severe cognitive delays. He requires a lot of support. Yeah. He is a very sweet, loving little boy. And honestly, as a CNA, I've recently realized I never had proper training in autism. It wasn't until I became an autism parent that I learned how to care for people with autism. However, I've recognized in characteristics of residents autism, and I did home care for a while, and I had 3 children when I did home care. I did pediatrics briefly. I actually hated pediatrics. It wasn't, and I did not like working with autism either. This was before I had kids. How ironic. Right. 3 pediatric clients on the autism spectrum, and I didn't like doing pediatrics, and I really didn't like working with children on the autism spectrum. I found it very difficult and challenging. Yeah. You can call that karma or whatever. But it has prepared me for when I go to doctor's appointments, when my child, because he cannot verbally communicate with me, so when he's doing a behavior, I can tell his stomach's upset just by the way he's acting. And I don't think it's just because I'm his mother. I think it's because, you know, I notice things. I know how to handle things when my kids vomit. When my kids get sick, I highly recommend to any parent, by the way, with a sick child to get puppy dog pads and just put them all over their bed, because my husband thought I was insane when I sent him to the store to get those, and I was like, just trust me on this, it's going to make life easier. And he got them, and when my child didn't understand the phrase in the bucket, again, I apologize for being a little raw, but we had those puppy dog pads down for like training, and it was so much easier to change those than it was all the sheets. So just a pro tip for everyone. But yeah, so it's trained me. Again, I'm going to probably be changing diapers on my son forever. I've changed diapers on adults probably more times than I have on babies. It's just trained me for a lot of that.
Right. So last year, or a little over a year ago, you started your podcast called the Caregiver Chronicles. Let's talk a little bit about your role with that and the purpose for that, and kind of how your professional life meets real world caregiving.
So I started the podcast. I was experiencing burnout, and caregiver burnout is a very real thing, whether you have children on the spectrum or not. You can experience, just being a CNA, you can experience caregiver burnout. It's very, very real, and it's one of the real hazards of the job. It's not talked about. It's talked about in the job a little bit. It's not talked about a lot in the world. There's a lot of stigma when a CNA does get burnt out, that, oh, well, they need to just take care of themselves better, rather than recognize all the layers of the things. I felt it important to discuss burnout. I felt it important to discuss topics related to being a CNA, because that's a big part of what I've done. Even though I'm no longer actively a CNA, I'm still working on putting together training for CNAs in different aspects where I feel like there needs to be more training.
Yeah.
Having just all my experiences as a caregiver, I needed to share with the world. I had people say to me, nobody wants to hear that. That's terrible. Or, oh, it sounds like you're complaining. And I needed to get it out there in a way, in a compassionate way, in a relatable way, because for every person who told me nobody needs to hear that, somebody else would say, thank you for sharing this, because I had no idea. I wasn't the only person going through blank.
Oh yeah. Especially being a caregiver, there's a lot of pressure being put on those people, whether it is professionally or it is a family member that you're, maybe there's 2 or 3 people that are in charge of mom or grandma later on in life, that, you really have to share the responsibilities. It's kind of reverts back to having a baby almost at some point in stage. Everybody has to contribute and share the roles.
And sometimes you don't sleep or eat or shower. Yep.
Absolutely. So with being able to share some of those stories, what have you gained as maybe a future career goals out of sharing those stories with your podcast, and as a CNA, you don't want to be a nurse, you don't want to be a doctor, as far as schooling wise, but what are some career goals? You mentioned working on some training and being able to help CNAs be prepared for their current roles.
Yes. Well, one of the main things I recently discovered, actually interviewing an adult on the autism spectrum, is that there is a lack of services for adults, which we kind of already knew, but there's an even bigger lack in the healthcare facility for education and training for autism. I have never once in my 17 years as a CNA had training on how to care for a person on the autism spectrum. I know another CNA who was a CNA in Connecticut for 20 years. She had never had training.
Yeah.
I reached out to fellow CNAs in various aspects of home care, long-term care facilities. None of them have ever had training. I worked with children on the autism spectrum in home care. and did not have training on autism. I had pediatric training on how to deal with their families and all this other stuff and how to work with kids, but nothing specific for autism. And I think that there absolutely needs to be, because just like Alzheimer's is very specific but it affects everyone differently, but there's very specific needs. Autism's kind of the same way. It affects everybody who has it differently. Every single person on the spectrum has different needs, but they're all on the spectrum. And there's, right now I am having trouble finding even nationally a program for that. So I'm trying to make one. Which is,
And
I have no idea how to do.
I feel like, and I may be wrong in this, but I feel like, autism is, I'm not going to say more of a newer diagnosis, but you hear of it a little more common in the last, 15, 20 years than you may have heard, 30 or 40 years ago. So
Yes.
those individuals that are, maybe now 20, 30 years old that got diagnosed early, and the younger generation, the 5 to 10-year-olds that are on the spectrum, they will eventually be, in their 70s and 80s, hopefully, and need that still kind of care. So I think that developing a process while you're learning along the way to care for that is a really good and important role that, all caregivers are going to need to understand how to deal with.
Absolutely. And, just because there's not a lot of diagnosis in older generations doesn't mean it doesn't exist. I have had residents who did not have a diagnosis, but I could have sworn they were on the autism spectrum. I actually had a resident tell me when I was talking to her about my children one day, just, we were just chatting, and she told me, she goes, I think I'm autistic. She said, because I sat down with a family on a cruise and they had a son who was autistic and the family was telling me about him. She's like, and most of what they said about him described me and all the things that make me feel different and weird. She said, but I never got diagnosed.
Yeah.
And I looked right at her and I said, if you wanted to pursue that diagnosis, I would support you. I said, and if you don't want to, that's fine too. I said, I'm still going to support you. I'm still going to be here for you. But her thing was, I grew up feeling weird. She was able to communicate. She held down a job. She was what would be, and I hate using functioning labels. But, she was somebody who didn't need a lot of support. She was someone who was able to take care of herself. She was higher functioning. Hate using the label, but, in this case, it's the best way to describe it, I think. She just never had a name to explain what made her unique. And when she said that to me, I realized that some of her needs might be different. When there's live entertainment, maybe she should sit towards the back instead of in the front row because it is going to be louder for her. When she said she had a headache because of the lights, okay, turn the lighting down or figure something out. And that balance in that community is difficult because most of the people cannot hear and can't see. And then you've got the one person with the hypersensitivities, and you have to figure out how to balance that. And you can't say to her, well, everyone else is fine. That's gaslighting her, and that's not fair. And these are things that I've realized throughout the years of, I can think of at least 10 people I've cared for over the years that maybe don't have a diagnosis, but there is no doubt in my mind we're on the spectrum somewhere.
Right.
So
I think
the statistics are 1 in 64 with children, and I wouldn't be surprised if they're the same with adults. It's just undiagnosed.
Yeah, I think that's going to be a really big thing. What's something that, looking back at your early years of being a CNA, you started when you were 17 or 18, working through straight out of high school. What's something you wish you would have known in high school that could help you now with your career, or, something maybe you wish you would have done different in high school?
I wish I had better grades in high school. I'll be honest. I wish I cared more about school itself, because my the fact that I could pass the CNA class in high school, but couldn't pass English was a little bit annoying for my guidance counselor. It was a little bit like, okay, you can tell me Latin words in medical terminology, but you can't pass English. She's like, you can pass what's considered a college level or post high school level class.
Right.
No problem. I wish I would have tried a little harder. That being said, I still don't think I would have wanted to be a nurse, but I don't know what I would have been
Where that
if I had the grades. Yeah.
so
I
maybe some career exploration type stuff besides just CNA, nurse, or doctor.
Yeah. Well, I did a little bit of that. I did take a break from CNA work at one point in time. I worked as a nanny briefly. I did bookkeeping. I worked as a maid in a hotel. I just didn't like any of those jobs at all. And I wanted to go back to CNA work. I really wanted to go back. And it was funny because when I walked back into the building that I was employed at, that I had resigned from because I wanted to figure out what I wanted to do, they said, "We knew you'd be back."
That's a good feeling to have.
Yes.
That is a good feeling to have. What are some of the like continuing education pieces that CNAs and medication aides need to have? If they are yearly or every 3 years, or how does that play into part?
So I believe it is state to state. So I don't want to 100% speak for
Right.
Missouri. I can speak for Rhode Island because I was licensed there. You have to have, as a CNA, you have to have facility training every year on things like washing your hands. We get a 20-minute training on washing our hands. What happens if you get a chemical or blood in your eye? Bloodborne pathogens is a big one. How to not hurt yourself on the job, because sometimes you have to pick people up off the ground. And I was a little tiny girl in high school. I was maybe 95 pounds soaking wet. And I was trying to pick people up with, of course, they never expect me to do that 100% on my own. I always had backup. But, lifting people, lifting packages, safety data sheets, you get the sexual harassment seminar in every job every year. I want to say they probably do that almost every year. We get that too. Abuse, elder abuse is a big one. Neglect is a big one. Respecting your residents' dignity, and burnout is one that we get every couple years, but not enough.
Yeah.
There's also CEUs for med techs that are separate from the CNA training that you have to take, where you go over the 5 rights: the right time, the right patient, the right dose, the right medication, the right route. You go over how to properly pour medications. You go over how to properly administer medications. We would talk about how to just what to do if you make a med error, and all those things. And again, hand washing. I want to say we have hand washing twice a year, and I think we have a PPE. I'm pretty sure we've had PPE before the pandemic. Yep. Where we've had to learn how to properly put on and take off a mask, how to properly put on and remove gloves. And your director of nurses will be standing over your shoulder while you're showing her how to properly take off gloves and wash your hands.
Seems very trivial, but it's something that's pretty important, especially when dealing with bloodborne pathogens and all the different kinds of stuff. What's a product, that as a CNA or a medical aid that you used on a daily basis that really helped you with your job?
All right, this is going to sound super trivial, but gloves.
Yeah.
I have said to my director of nurses one day, we had gloves in the building, we just couldn't access them. And I looked right at her and I said, if we don't get gloves, I'm leaving. I'm not doing this job without gloves.
Oh, absolutely.
And I know that sounds silly and trivial, but that's probably the most used product as a CNA. I would come home with pockets full of gloves because you just shove them in your pocket and go. And every room you're washing your hands, you're putting gloves on. when every patient, everything, your glove gets soiled, you change that glove. You go, it's just, I don't know. We probably go through like a box of gloves a night.
Yeah. So this is a two-part question. If you like and dislike blank, then being a CNA is and is not the right career path for you. So let's go ahead and start with if you like blank, then being a CNA is the right career path for you.
If you like people, being a CNA is the right career path for you. You have to love, you don't have to like people, you have to love people. You have to care about people. Because that's what you're doing. You're going into somebody's house and you're doing some of the most intimate care they will ever have. And if you think you might like to care for somebody, then being a CNA is good for you. As far as don't like,
yeah,
I'm gonna say poop. If you don't like poop, I mean, nobody likes poop, but I mean, if you really can't handle poop, just don't do it. If you don't want to be there, if you don't care, is really my real answer. If you don't care about people that much, if you don't want to be around people, don't be a CNA. Do something else. There's lots of other jobs where you don't have to take care of people.
Absolutely. And then the last one I have for you, is do you have a mantra or a quote that you kind of live professionally by?
Yes. I always try to take care of everybody as if they were my parent, my grandparent. I wanted to treat every single, and I hope I did treat every single one of my residents like I would my own grandmother or my own grandfather. Because someday that may be you, your grandmother, your grandfather, or your child who needs a CNA. You don't know. You don't know who in your family, your parent, your sister, whoever that needs a caregiver, and you want them to treat them with the most respect and dignity as possible. And I think reminding yourself that if this, even especially when they're having their worst moments, when someone with Alzheimer's is just really agitated and upset, rather than going in there and yelling at them, that's only going to make the situation worse. Sit down and try to find out where you can find a common ground with that person and how you can help them.
Right. Yeah, that totally makes sense. Is there anything else you'd like to share about the Caregiver Chronicles? The little marketing blurb for your.
No, I appreciate it. So Caregiver Chronicles is a podcast. Me and my husband do it mostly together, but I have lots of guests on. There's lots of great episodes on Alzheimer's, lots of great episodes on autism, and it has been therapeutic for me as a caregiver, as a way to get my story out there.
Right.
And yeah, I do have an episode on caregiver burnout, and I would recommend to anybody who wants to become a CNA right now to listen to that episode. It's not exactly pretty, but it's something you or a coworker may experience, something you should really know the signs of, because you don't want to get to that point. You want to stop your burnout before you get there. And we talk about coping mechanisms and recognizing the signs of burnout. And if I had to pick just one episode for anybody who's a caregiver at all, whether it be a CNA or whatever, I would highly recommend the burnout episode. I think that's our second most listened to episode, and with good reason.
Absolutely. Well, thank you so much for spending your afternoon with us here and talking about your career and your profession, and how you got there and why being a CNA is so important. We really appreciate the time.
No, thank you so much for having me. I really appreciate it. It was a great opportunity for me, and just I really hope that if somebody is interested in this career path, or maybe they're on the fence, maybe I swayed them to do it if it's what they're supposed to do, and if they're not supposed to do it, hopefully they realize, nope, this isn't for me, and find something else. And that's okay too. It's not for everyone, and that's okay.
Well, thank you again. Really appreciate it.
Thank you so much.